Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Types of opioids used for chronic pain relief. Opioids have long been used to treat severe pain, though their use in the management of chronic pain remains somewhat controversial. Some people can tolerate opioids for years without any adverse effects, while others may become physically dependent or even develop a tolerance with regular use. Like most medications, opioids work differently for everyone. /r/n/r/n Opioids can have profound effects when not taken as prescribed. Your healthcare provider will work with you to determine the best medication for your pain. /r/n/r/n This article explores what opioid medication is, types of opioids, and side effects. It also discusses non-opioid alternatives and how your healthcare provider will determine the right choice for you. /r/n/r/n Opioids are an analgesic, or medication used to control pain sensations. Because they are classified as narcotics, they are available by prescription only. Opioids work by attaching to specific receptors in the nervous system and changing how the brain perceives and interprets pain. Opioids may be given in the following ways: /r/n/r/n If you are prescribed opioids for chronic pain, chances are you will be using either an oral or patch form or a combination of the two. /r/n/r/n Opioid medications bind to opioid receptor cells in the brain, spinal cord, and other parts of the body. Pain signals are blocked from reaching the brain when binding to these receptors. Some opioid medications include /r/n/r/n There is no single opioid or non-opioid pain reliever that is ideal for chronic pain. The underlying cause of chronic pain is an essential factor, as well as individual variability. Working closely with a healthcare provider is the only way to know what might work best for your chronic pain. /r/n/r/n Before opioids are prescribed, most healthcare providers will recommend non-opioid medications to prevent the side effects and risks associated with opioid use. Although some of these medications may have potential side effects, they are typically more appropriate than opioids for long-term use. These include /r/n/r/n Opioid use may be considered when non-opioid analgesics have failed to provide pain relief. If these analgesics are not effective against your chronic pain, your healthcare provider may consider something stronger. Opioids vary in strength, and some may be combined with other pain medicines. /r/n/r/n Opioids carry side effects, some of which are mild and some of which are potentially life-threatening. Some potential side effects include /r/n/r/n One of the single most significant risks of opioid use for chronic pain is developing a dependence and/or opioid use disorder. /r/n/r/n Those with opioid dependence experience withdrawal symptoms when their opioid medication is discontinued. They may use more of the medication to achieve the same high feeling, which increases the risk of overdose. /r/n/r/n Those who develop opioid use disorder use their medication in ways other than prescribed. When the prescribed opioids are not sufficient to produce a high, people with opioid use disorder may seek additional opioids by buying them illegally. This can sometimes lead to people turning to heroin, which produces similar effects but is often less expensive. /r/n/r/n The type of opioid you are prescribed will depend on the type and quality of your pain. Unless you have tried other non-opioid medications without relief, your healthcare provider may not prescribe you opioids at all. If non-opioid analgesics have not been effective for you, your practitioner may start you on a mild opioid such as codeine. Or, he may try you on an opioid that is mixed with aspirin or acetaminophen. /r/n/r/n If your pain is more severe, you may be given something stronger, such as oxycodone. Your healthcare provider may try both short-acting and long-acting forms to see what works best for your pain. He may also combine stronger opioids with other analgesics, depending on your needs. /r/n/r/n Like most other pain medications, you may have to try more than one type of opioid or opioid combination before you find relief. /r/n/r/n Chronic pain can be a complex condition to manage. Still, different types of opioid medications can help. In addition to non-opioid medications like NSAIDs, acetaminophen, antiseizure medication, antidepressants, and COX-2 inhibitors. It is essential to realize that opioid use, especially long-term, carries the risk of overuse and dependence. A healthcare provider should monitor the use of opioids carefully. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.